So I'll do a brief introduction and then you can start. Fawwaz, are you ready?
Yes, sir, I'm ready.
So I welcome you all to yet another session of the Readiness Corner module. These sessions are arranged by the Department of Neurosurgery at Liaquat National Hospital. The idea behind this session is to build a 3D neuroanatomy, which is very important for any neurosurgeon when performing any neurosurgery. The topic of our presentation today is middle cerebral artery. Dr. Fawwaz is fifth resident at Liaquat National Hospital. Dr. Fawwaz, please start your presentation.
Okay. Assalamu alaikum. So today we'll be discussing about the anatomy of the middle cerebral artery. We have already studied the anatomy of the internal carotid and the anterior cerebral. So the topic for today would be the middle cerebral, and that will be followed by the posterior fossa arteries, inshallah, next week. There is a bit of text in this presentation in order to learn or basically know the anatomy and the names of the different vessels that will be coming across. So if we start with the basic introduction, we all know that the internal carotid artery actually divides into the anterior cerebral artery and the middle cerebral artery. We have already studied the course of the anterior cerebral artery, and all these vessels actually supplies the different parts of the brain, as well as they contribute to the circle of Willis, which is formed by the contribution from all these arteries. So today we'll be discussing the middle cerebral artery briefly. So if we study it, it actually arises from the internal carotid artery, where it is lying within the carotid cistern. So actually the internal carotid artery is encased by the carotid cistern. So the initial most part of the MCA would be covered or encased with the carotid cistern. We'll also be seeing this in later on diagrams, but I'll be repeating it throughout again and again so that we can learn these. The MCA then divides into few of its segments, which are very important. We also study them in theory, as well as when we perform angiograms, we notice all those segments separately. So there are four important and theoretically important segments of the MCA. The first is the M1 segment. This is followed by the M2 segment, followed by the M3 segment, and then the M4 segment, which is the final part. So this is just a schematic diagram. For instance, we are seeing the lateral view of the hemisphere. This is the frontal lobe, and this is the temporal lobe. The MCA would travel within the depth of the Sylvian fissure, and this initial portion of the MCA is called the M1, or the horizontal segment, as it actually traverses horizontally. Then the MCA actually bifurcates into two branches, which is the superior trunk and the inferior trunk. And here there is an important thing which is called the genu of the MCA. The genu anywhere is actually a sharp turn. So here the middle cerebral artery sharply turns around 90 degrees, and this is called the genu of the MCA. So the MCA may bifurcate prior to the genu in some cases, or at the genu. There is a certain variation. So the MCA is traveling horizontally. It would bifurcate into two segments, the superior segment and the inferior segment. This bifurcation may occur prior to the genu or at the level of the genu. So this is an important point to learn. Here your M1 segment would end. At the genu, it sharply turns around 90 degrees and travels posteriorly within the depths of the Sylvian fissure. This is actually called the insular segment because it is related to your insular cortex of the brain. Then it again turns 180 degrees, and this segment is related to your frontoparietal opercula superiorly and the temporal operculum inferiorly. So this segment is actually termed as the opercular segment. And then it would come onto the surface of the Sylvian fissure to be distributed on the cortex of the brain, the frontal cortex, the temporal cortex, the parietal cortex. So this is called the cortical segment. So in brief, if we describe this figure, you have four segments: the M1, which is the horizontal segment of the MCA, followed by M2, which is the insular segment, where it turns sharply at the genu of the MCA, followed by the opercular segment, again with the superior and the inferior trunks, and then you have the cortical segments of the MCA. An important landmark here is just before the bifurcation in most of the cases from the M1 or the horizontal segment of the MCA arises few branches which are very important. They are called the lenticulostriate arteries, which would pass on anteriorly to be distributed via the anterior perforated substance into the deep gray matter core of the brain. So this is just an overview. We'll be dealing with all these segments in different pictorial and theoretical aspects in the later few slides. Again, a similar schematic diagram. This is the ICA dividing into the AC and the MCA. The MCA would be divided into M1 segment, which basically converts into M2 at the genu. So this is the M2 segment with the superior and the inferior trunks, which is related to the insular cortex, and hence it is called the insular segment, followed by the opercular segment, which is the M3, and followed by the cortical segment. Important landmark here is just before the bifurcation, in most of the cases from the M1 segment arises the lenticulostriate arteries. In this diagram, if we could see here, this is the Sylvian fissure, and we have retracted the operculum. The superior one is the frontoparietal operculum, and the inferior one is the temporal operculum, to see within the depth of the Sylvian fissure, the insular cortex and the vessels which are related to it. This is just a small diagram. We'll be dealing again separately. Now, again, in this diagram, there are different color-coded regions of the artery. The initial blue colored region is actually where it bifurcates from the ICA. The ICA coming over here, and it bifurcates into the ACA and the MCA. So this is actually the first segment, which is called the horizontal segment, and it is also called the sphenoidal segment of the MCA. Here, it would turn sharply backward. Now here you could notice that this is traveling horizontally, and here you could see that this is the insula of the brain. Insula has again its own sulci. So this is the central sulcus of the insula, and the insular anatomy will be dealt again later in next few sessions. This horizontal segment or the central sulcus of the insula divides it into the short gyri above and the long gyri below. This is the Lyman insulae. It is actually the projection of the insula at the antero-inferior aspect, where the M1 segment ends and the MCA takes a 90-degree turn at the cortical surface of the insula, turns sharply backward, and it is named here as the M2 segment or the insular segment. Later on, it again turns a 180-degree turn. And here it is related to the opercula of the brain, and this is termed as the opercular segment, which is labeled here in yellow color. And then you have the orange colored branches, which are actually the cortical branches that are distributed towards the surface of the brain. Now, this is actually the dissection without any cuts. So you could see that on the cortical section, on the cortical surface, the frontal lobe, parietal lobe, and the temporal lobe is being supplied by the branches of the MCA, which is the cortical branches. Whereas if you cut this vertically, you could see that these are the branches of the MCA which are within the depth of the brain. Here you could also see the anterior perforated substance where the lenticulostriate arteries from the M1 segment would pass on to be distributed into the deep gray matter of the brain, including the caudate, putamen, etc. We could also see here few of the landmarks of the insula. The first that we have already discussed is the Lyman insula.
Doctor, can you please mute Dr. Lukman?
Sorry, sir?
Sir, can you mute this one of the participant, Dr. Lukman Hadi? Dr. Lukman, can you mute yourself, please? Yeah, thank you. Thank you. Please.
कभी ज्वाइन कर रहा कभी नहीं कर रहा. Okay, so this was the diagram that we were studying at that time. Here we can see that the insula is related to the few anatomical projections. The first is the Lyman insulae, which is actually at the anterior-inferior aspect of the insula, where your M1 segment sharply turns. And then at the lateral limit of the insula, which is the circular sulcus, which is labeled here, this is the lateral limit of the insula. Here, your M2 segment would end, that is the insular segment would end here, and this would be followed here by the yellow colored segment, which is the opercular segment. So we have already remembered the names by now. Moving ahead, this is another pictorial representation, and this pictorial representation actually shows the tortuous course of the MCA. That is, it starts at the anterior aspect where the ICA splits into two, and then it would be projecting posteriorly. And also in its course, it makes two 180-degree turns. One is at the posterior aspect, which is the M2 portion, and then the M3 portion again projects 180-degree to be projected towards the cortical surface of the brain through the Sylvian fissure. So if we see in this A diagram, this is a cut section through the anterior part of the frontal and the temporal lobes. You could see here that the M1 segment is more visible here. So this is the M1 segment. Then the M1 segment actually projects posteriorly, and it is related to the insula. So that segment is more clear in the sections of the posterior cuts. That is, for instance, the diagram B. This green colored label, the M2 structure is more clear because it is projecting posteriorly. Then the M3 segment again makes a 180-degree turn and comes ahead. So this is the opercular segment, and here it is related to the operculum of the frontal lobe, the parietal lobe, and the temporal lobe, and then it projects laterally so that it is projected towards the cortical surface as M4 branches. This is all what we studied in the diagrams. We'll be revising it through the text. The M1 segment, which is also called the horizontal segment, it is the most proximal segment of the MCA. It begins at the carotid bifurcation and it extends to the bifurcation of the MCA. Now, we already studied that the bifurcation of the MCA can be at the level of the genu, or it could be prior to it. Here, it is usually at the level of Lyman insula, and here it splits into two branches, mostly two branches, the superior and the inferior trunk, but sometimes three branches can also be present. The MCA then courses laterally in the area above and anterior to the temporal pole, and it turns posteriorly in the Sylvian fissure. So that was about M1. The M2s then give rise to around 8 to 12 branches before they become the M3s at the peri-insular sulcus. So the sulcus, which is on the lateral aspect of the insula, is also termed peri-insular sulcus, or it is called as the circular sulcus. At the level of the circular sulcus or the peri-insular sulcus, the M2 ends. And here you have the M3s, which continue to the surface of the Sylvian fissure at the lateral surface of the brain. The M4 segments are located on the parasylvian surface of the brain, and they supply the lateral cortical surface of the cerebral hemispheres. Now we'll again be dealing with all those segments separately. So this is the M1 segment. If we see here diagrammatically, this is the ICA. The ICA divides into anterior cerebral, which we have already discussed in the past sessions, and the middle cerebral artery. So this M1 segment courses within the depth of the Sylvian fissure. At the level of the genu, where it turns posteriorly, it divides into two trunks, the superior and the inferior trunks, which are of the M2. And prior to this bifurcation, it gives off the lateral lenticulostriate arteries, which are very important perforators coming up from the M1s. And they would supply via the anterior perforated substance to the deep cortical matters like putamen, basal ganglia, and all those. This M1 segment is also called as the horizontal segment, and it is also called the sphenoidal segment of the MCA. Later on, the M2, which is related to your insular cortex. Here you could see that within the depths of the Sylvian fissure, this is the insula, and this M2 is related to your insula. So this is the insular or the M2 segment. Later on, it would convert at the level of the opercula into the M3 segment, and then it would be distributed towards the cortex as M4. The landmarks or the limits are M1 arises from the bifurcation at the level of the Lyman insula or the genu. It would convert into M2. At the level of the circular sulcus or the peri-insular sulcus, it would convert into M3, and then at the cortical surface, it would divide as the cortical branches. So again, this is all the revision. The M1 starts in the Sylvian cistern at the carotid bifurcation. And few relations important to this are that M1 is superolateral to the optic chiasm. You could see here, these are the optic nerves. These are the optic nerves dividing into, forming the chiasm and later on tracts. So this is actually superolateral to the chiasm. And this is inferior to the anterior perforated substance. Anterior perforated substance would be somewhat here, and it would be located superior to these vessels. And the lateral lenticulostriate arteries arising from the M1 would enter the anterior perforated substance to be distributed into the central gray matter core of the brain. And this is also posterior to the division of the olfactory tracts, which would be somewhat here. The M1s travel laterally in the Sylvian fissure until the bifurcation at the insular apex. This region, the Lyman insula or the insular apex, are actually synonymous terms. At the MCA bifurcation, it splits into two branches, the superior trunk, which is also called the frontal trunk because it would be facing the frontal lobe, and the inferior trunk, which would be facing the temporal lobe, is called the temporal trunk. Now, there are few important branches of the M1. M1s actually gives of the most important branches that we have studied, which are the lateral lenticulostriate arteries, which are variable in number. They can be 3 and they can be up to 20. And these would be passing through the anterior perforated substance into the gray matter structures located centrally in the brain. The anatomy of the anterior perforated substance would be dealt with separately in sessions coming ahead. Later on, it also gives a few cortical branches to the region where it passes by, and they are often named as temporopolar because it would be supplying the temporal pole, frontotemporal supplying the frontal and temporal areas, and the orbitofrontal branches supplying the orbital regions of the frontal lobes. In the surgical trajectory to the Sylvian cistern, the cortical branches mainly project towards the temporal lobe and less often towards the frontal lobe. So they would be more often projecting towards the temporal lobe, as in 75% of the cases. The lateral lenticulostriate arteries originate mainly from the M1 trunk, and their identification should help distinguish the true MCA bifurcation. This we have already seen pictorially. The lateral lenticulostriates are quite variable in number, and they may be up to 20, and there is also variability in their site of origin. The most commonly that we see is from the M1 segments prior to the bifurcation, and they pass on ahead to be distributed via the anterior perforated substance. So the distribution of the lateral lenticulostriates, they are mainly arising from the frontal aspect of the M1, and they mainly turn towards the frontal lobe. They enter the brain via the central and the lateral parts of the anterior perforated substance. The anterior perforated substance is actually divided into many regions or zones. So they are distributed via the central and the lateral parts, and they supply the substantia and nominata, the putamen, the globus pallidus, the head and the body of the caudate, the internal capsule, the adjacent corona radiata, and the central portion of the anterior commissure. Now coming to the M2 segment, this is actually a short segment. After their origin at the MCA bifurcation, the M2s run somewhat parallel and they supply the insula. So the M2 segment is also called the insular segment that we have already studied. The M2s are actually two trunks. So you have a superior trunk, which is also called the frontal trunk, and the inferior trunk, which is also called the temporal trunk that we saw diagrammatically. They are seldom of equal diameter, only in around 15% of cases, and mostly the inferior trunk or the temporal trunk is a dominant one in around 50% of the cases. They give rise to 8 to 12 branches, which mainly arises from the superior trunk before they become the M3s. The M3s are also called the opercular segment. The superior or the frontal M2 is the origin of the prefrontal. Now, the vessels actually passes near the brain areas and supply the vasculature to all those areas. So M2 would be related to the origin of the prefrontal, precentral, and central arteries, and they mainly supply the inferior frontal cortex, the frontal opercular cortex, and also the cortex in the parietal and the central sulcus. So these are actually the regions where it courses across. Whereas the inferior or the temporal trunk would be mainly the origin for the inferior lobe, that is the temporal lobe, the origin of the posterior and the middle temporal arteries, supplying mainly the middle and posterior temporal cortex, temporo-occipital, angular, and posterior parietal regions. Then coming through to the M3 segment, the M3s mainly supply the medial opercular surface and to a lesser extent the superior or inferior peri-insular sulcus. The M4s are actually the cortical branches. They are located on the cerebral cortex. They supply the 12 documented arterial territories of the lateral surface of the cerebral hemisphere, which are named and diagrammatically represented as, for instance, if we start from the front, the orbitofrontal, prefrontal, precentral, central, anterior parietal, posterior parietal, angular, temporo-occipital, posterior temporal, middle temporal, anterior temporal, and temporopolar. So these are all those vessels which are the branches, which are the 12 documented main branches of the M4, that is the cortical segment of the MCA. So viewing few other aspects of the anatomy, the M1 to the M3 segments of the MCA actually travels inside the Sylvian fissure for most of its course. Only the proximal portion of the M1 segment, where it divides from the ICA into the ACA and the MCA, here it would be related to your carotid cistern, which is limited by the proximal Sylvian membrane from its lateral border. And after piercing or after passing through this proximal Sylvian membrane, it would come into the Sylvian membrane. It would come into the Sylvian cistern. So this is actually your Sylvian cistern where the initial part of your MCA would be rising. Now there are few segments of the Sylvian compartment as well. It is usually in the anterior compartment of the Sylvian cistern where most of the lateral lenticulostriate arteries can be found. The borderline between the anterior and the posterior compartment of the Sylvian cistern is the Lyman insula. The posterior compartment of the Sylvian cistern is located behind the Lyman insula, where MCA before or after bifurcating makes a relatively sharp, almost 90-degree turn, which is the genu of the MCA. So if we see here diagrammatically, this is the M1 segment. This is your carotid artery dividing into anterior cerebral and the middle cerebral. This initial segment of this MCA would be lying within the carotid cistern, and here it would be proximal Sylvian membrane that would divide its course, and then the M1 comes into the carotid cistern. Again, it is divided by the intermediate Sylvian membrane and the lateral Sylvian membrane into few other segments which are anatomically related. The posterior compartment is further divided into medial and the lateral compartments by this intermediate Sylvian membrane. This is the intermediate Sylvian membrane, and this is the posterior compartment, which is again divided into two further compartments. The medial compartment contains the M2 trunks, whereas the M3 segments passing towards the cortical surface runs for most of their course in the lateral compartment. In general, the portions of the MCA that are most difficult to reach are on the M1 segment once it has entered the Sylvian cistern, as the cisternal space here is very deep and narrow, and there is a high risk of injuring the lateral lenticulostriate arteries which are present there. The other challenging region is the very distal part of the Sylvian fissure, which is also narrow, and there is risk of damage to the cortical MCA branches. Fortunately, most of the MCA aneurysms are located at the MCA bifurcation, which can be found in most cases at the border of the anterior and the posterior compartments, where the Sylvian cistern is wider and can be approached better. Now, this is almost done we'll be revising all those that we did with pictorial representations again. There are a few important perforating branches. The perforating branches of the MCA enters the anterior perforated substance, and they are called the lenticulostriate arteries that we studied. There is an average of 10, and their range may be around 1 to 21 lenticulostriate arteries per hemisphere, which arises from the pre-bifurcation part of the M1 in every case and from post-bifurcation in half of the hemispheres. Mostly, and even in pictorial representations that we saw, they were arising from the pre-bifurcation segment, that is the M1 segment. The earlier the bifurcation, the greater would be the number of post-bifurcation branches. The lenticulostriates are divided into medial, intermediate, and lateral groups, each of which has a unique origin, composition, morphology, and characteristic distribution in the anterior perforated substance that would be dealt with the anatomy of the anterior perforated substance. So this is actually the ICA dividing into the anterior cerebral and the middle cerebral. This is your first segment, or the M1 segment, which is also called the sphenoidal or the horizontal segment of the MCA. The right M1 divides at the bifurcation. So this is your bifurcation point where it divides, and this could also be at the level of the genu in most of the cases, or the Lyman insula. And the lenticulostriate arteries arises from the posterior-superior aspect of the M1, and they are distributed towards the anterior perforated substance so that they supply the deep gray matter core of the brain. This picture shows the upper surface of the temporal and the occipital lobes. The M1 segment courses along the stem of the Sylvian fissure below the anterior perforated substance. It would be here. This is the M1 segment. And then it turns sharply posteriorly at the level of the genu or at the level of Lyman insula. And then it becomes the M2 segment, which is related to the insula of the brain. So it is called the insular segment. And it usually has two trunks, a superior and an inferior trunk. Later on, it again turns at the level of M3, and this is related to the opercula of the brain. So it is called the M3 or the opercular segment, and it is distributed on the cortex of the brain as M4 branches. Now here in this diagram, the temporal lobe has been removed to expose the M1 bifurcating into superior and inferior trunks. You could see in this diagram that this was M1 arising from the ICA, and here it is dividing into a superior trunk and an inferior trunk. This is the superior trunk and this one is the inferior trunk. Both of these trunks would be related to the insula of the brain, and this is forming the insular segment or the M2. They would come ahead and would be related to the M3, the opercular segment of the brain. The superior trunk, as we already studied, would be supplying most of the frontal lobe, and the inferior trunk would be supplying most of the temporoparietal lobe. The M1 courses below the anterior perforated substance that we studied previously. The M2 courses on the insula. The M3 passes around the opercular lips, and the M4 is formed by the cortical branches. This is again almost a similar basal view representation of this diagram. The M1 segment would be somewhat here, which is not very clear in this picture, and it is dividing into two segments, the superior segment and the inferior trunk, which is the M2 segment. And then it would be related to the opercula here as M3, and then it would be distributed towards the cortical surface, the M4 segment, which is not shown here. Now, this is for the better representation of the cortical surface. Your Sylvian fissure has been opened. In this diagram, if you see, the lips of the Sylvian fissure have been retracted, and this shows the M2 segments. The M2 segment is usually having a pattern of one trunk being dominant. The inferior trunk is dominant in most of the cases, and this diagram shows inferior trunk dominant type of the M2 segment that supplies majority of the lateral convexity of the brain. Whereas if you see this diagram, this is a further deeper dissection. The Sylvian vallicula is the opening between the lips of the Sylvian fissure at the Lyman insulae, where the MCA would turn posteriorly to form the M2 segment. Here you could see that this is the insula. M1 would be coming somewhat here, and then it is dividing into your M2 segments with two trunks, the superior and the inferior trunk. And this is the level of the turn. So this is called the genu, where the M1 turns posteriorly and divides into two branches. Later on, this is the M3 segment, which is related to the opercula. The two opercula have been removed here in this diagram. So this would be the M3 segment. And furthermore, it would be distributed towards the cortex of the brain as M4 segments. This is another hemisphere with the lips of the Sylvian fissure retracted to expose the branches forming the M2, M3, M4, which is crossing the insula and passing around the opercular lips to reach the cortical surface of the brain, where the cortical branches to the brain would be distributed. An important aspect here is the Sylvian point. Sylvian point is located where the most posterior part of the M2, which is the insular segment, which actually courses posteriorly, the most posterior part of the M2 turns away from the insular surface and towards the lateral convexity. So this most posterior point where the M2 turns backward to be supplied to supply the lateral convexity, here this turn is called the insular point, the Sylvian point. And it coincides with the point where the most posterior of the transverse temporal gyri intersects the insula. Okay, so this was about the anatomy. If we see an angiographic orientation to this, this is the ICA. And here there are turns of the ICA that we dealt with the IC anatomy. It would be divided into the anterior cerebral and the middle cerebral. So you could see that this is the first segment, which is the sphenoidal segment or the horizontal segment, which is also called the M1 segment. At the level of the genu or the Lyman insula, this turns sharply posteriorly, and this region is called the genu. At the level of the turn, the M1 converts into the M2 segments, and it is usually bifurcated into two branches, the superior and an inferior trunk, and this is called the insular segment as it is related to the insula of the brain. Later on, it is related to the operculum. It turns again. At this level, it is called the opercular or the M3 segment. And furthermore, it moves ahead to be distributed to the cortical branch areas of the brain as M4 segments.
Can you show the lateral lenticulostriate as well, arising from the M1?
Yes, they are visible here. So the lateral lenticulostriates actually arises from the M1 segments prior to the bifurcation. So they are somewhat here as these branches.
Thank you, Dr. Fawwaz. Is there anything else you want to add at the end, or was this your last slide?
Sorry, that's the last slide.
So that was an excellent presentation. The anatomy of the MCA is very important and goes in hand with the Sylvian fissure, which I think should be discussed in the upcoming sessions. So
yes, sir.
While doing an ACOM aneurysm, it's technically more difficult than doing an MC aneurysm, but ACOM aneurysms are forgiving because they're collateral supply. While in MCA, there's no collateral supply, so the probability of stroke is very high. So it's very important to know your anatomy and knowing where your lateral lenticulostriate is. And I think that was a good presentation. And if there's any question from the topic from the participants, we will take it. If there's any question, we'll take the question now. Otherwise, we'll end the session. The participant on the Zoom can use the chat box for the session. What is the topic for the next week, Dr. Fawwaz?
Sir, either we could continue with the PCA, or if we would like to deal with the anatomy of the insula, both would be related.
I think if we can do the anatomy of the insula along with Sylvian fissure dissection, I think it will go in hand with the MCA that we just discussed.
Okay. So next week we'll be doing insula along with the dissection of the Sylvian fissure, followed by PCA later on. Okay.
So I don't think there's any questions from the participants. Thank you all for joining. I hope these sessions are helping you all. And all these lectures are available on the official YouTube channel for the Liaquat National Hospital as well. You can go back later and check them and maybe use them go through them before your exam or any surgery. Thank you, Dr. Fawwaz, for this presentation, and we'll see you all next week. Take care.
Thank you, sir.